something really transformational today. I want us to have an agenda that every time I'm up on a stage, we're talking about it, every time every one of you is connecting on Facebook to somebody, you're saying the same thing, because that's how we make change happen, isn't it?
I am a music educator. So yesterday morning I was lucky enough to have 60 wonderful, very tired, uninspired teenagers in front of me at a band rehearsal. And I'm a practicing music educator, and I use that word very, very deliberately. I am a practicing teacher, just as I believe I am a practicing artist. So my students are my works of art. I put together things that don't get put together. I try really hard to turn everything on its head and say, if we turn this back to front or upside down or inside out, what would that mean? What would that look like? How would that possibly make us think differently? So I have no idea where this came from, but I have a very strong belief that everybody I meet is an artist of some description. They make something. They behave like an artist in some way. And that's the kind of reaction that I look for in everyone. I try and find out what it is that they love, because what they love is what their art is. So a lot of what's also happened in being an educator is I have looked for my way of learning and my way of being an artist, and it means going and sitting with people.
My name's Helen Zigmund. I'm from Sydney, New South Wales, and I was a board member of the Institute for Creative Health, and I've been an arts and health practitioner for 30 years. But if we actually divest ourselves of the sensate world, we will feel ill at ease, and I think that we have to make sure that we bring the senses into everything we do, whether that's health, education, or the arts. It's all about what we feel and how we can express that.
And really indulge a little bit in this fabulous space and the wonderful art exhibition that we have around us here, and what the creative process really is, and how accessible the arts are and should be to everybody. That term, access to the arts, sometimes we are using arts and health. We become so health orientated or so arts orientated that actually we forget the reason why the art should be within all context of our lives, whether it's in community, whether it's in healthcare, whether it's in education. It's really to make the quality of life overall much better, no matter what age you are, no matter what stage you're at. If it's in hospital, residential, nursing care, is a person. They're not a set of lungs, they're not dementia, they're not Parkinson's disease, they're none of that. They're not children that have, dyslexia. They're actually people who are living and breathing and have a soul and have an immense capacity for creativity and artistry. So I think that when we talk about access for all, we're talking about how the arts can bring a different perspective into a healthcare setting.
My name's Sally Francis. I'm the Arts Coordinator on Arts in Health at Flinders Medical Centre. Flinders Medical Centre is a 760-bedded acute care hospital in the south of Adelaide. We have a large program here. We've been running for 22 years. We sit within the Department of Allied Health in the hospital, and we have a total of 11 artists that all work on the program. So we deliver a service in the hospital. We have a patient referral system, so patients can get referred to us, and in addition to that we have supportive materials and nurture packs. We run workshops and we do roving with all our activities. So our different artists include visual art activities, performance activities, live music. We have a harpist that works one day a week. We have art therapists and music therapists, an art trolley, a creative writer, and this is for patient support as well as also supporting staff. So we have things like mindfulness, meditation and yoga as well, which supports staff in their daily work.
Unfolding creativity, and for us it's a vision, and this is my sort of invitation to you today from Northern Ireland's perspective and from the UK's perspective, when I will be talking a little bit later on in my conversation with you, that it is important to look at arts and health from a global perspective as well as a local perspective. And that's what's been very exciting for me to come from Northern Ireland, to tell our story, to look at your story here and to see how we can really cover the world. But it is a big job to actually integrate creative caring workforces into healthcare, education and community through interconnectivity. Now, we're working quite a lot on the development of creative caring workforces. Why do we need not only caring workforces, but why do we need creative workforces?
To deal with the stress.
To deal with stress, yeah, is one thing, yes.
We're going to be needing it at some stage.
You're going to be needing your creativity at some stage. So there's all different, we could go on here all night exploring that, but one of the most significant findings that we have found in Northern Ireland is that self-expression of patients, of visitors to the hospital, of the staff who work in the hospital, of the local community is very, very integral part of how we as human beings care for each other. How could I be the creative radiographer? How could I be the creative nurse? What makes me better qualified, more impactful healthcare professional, and use my creativity to enhance the experience of someone who is in care or who is in hospital or who really needs us to draw close to them and deal with them in very vulnerable situations.
Arts and health is actually crucial because it gives people other ways of dealing with their situation and actually just enhancing their life. See, it's not even a deficit model, it's something where it's adding, and it's relatively easy to do. But I guess that's where I can see, at least when you have passionate people who are passionate about the arts and they try to bring that to health settings, you know, you're going to see the results from it. And it does have a future. I guess it just depends on things like funding and commitment also from the artists as well. Yeah.
I'm Mandy Archibald and I'm an artist and research fellow. You know, how do we engage communities with complex topics that are often difficult to talk about, like frailty and healthy aging? Like today we came into the community and brought our research that was packaged in a way that is meaningful for people and give people the opportunity to tap into their own creativity and create with one another and connect with one another over a really complex topic that means something to them. So I was just so stunned by how engaged everybody was in the art making process. Today was the first time that we had used screen print monotypes as a method of visual engagement around research, and I can attest that it was quite a remarkable thing to see people making the mark and connecting their concepts around this notion of frailty, aging well, and all the associated ideas with that. It was quite a successful process, and the prints that we produced from that were really quite stunning. So there's something about the impermanence of creating the monotypes and the screen printing. I think that was less daunting for people in terms of that engagement.
Petrova and I am from Adelaide, South Australia. I am a dancer and theatre maker and choreographer. I think that a lot of ideas are complex in our current world, and a lot of questions that we have going into the future require a different approach, which I think comes from art, and therefore I think that the impact of putting art and science together is creating accessible ideas for people that may otherwise not engage with new ideas in science, design and technology.
Petrova Felber. I'm a Swiss artist, born in Switzerland in Lucerne, came to Australia in 1980. I have an architectural background, and then my passion of childhood took me back to visual arts, of art practice, that are allowed to have a common voice, which is not necessarily the origin for the arts, and is much more the origin of human communities.
We'll just sort of finish off with a few sort of thoughts about how we in our roles as move things forward
Mental health within artistic communities as well. So not just talking about health within health communities, but also looking at mental health within artistic communities, which is important. So wild, great, fantastic ideas. What I take from the connections part is that there are connections already here. Let's build them and make them stronger, and also let's think a little bit differently about how we work upwards, or come from the top down and go from the bottom up, because we are the change.
Around, we talk about artists, and we talk about scientists, as though, and we do this the same all around health sectors. We talk about consumers as though it's one kind of homogeneous group. And I'm not necessarily sure that that serves our interests the best. So I suppose just considering, what size of brush stroke are we hoping to paint each of these groups with?
Pointed out that among other things related to this, that it has a physiological effect. So like it's long-term benefits, its benefits full stop are profound. I guess beyond what is, relatively trivially, the whole sport kind of analogy by way of, how we might engage. It's deeper, it's bigger, it's more profound than that.
Physically well placed to cooperate and talk and communicate, and it's just a matter of getting together and actually advancing the program and the idea, really for the well-being of the state, and I think ultimately for everyone's well-being. So I'm very grateful to you all for taking the time to come here today to start that process. Thank you all very much.
We have developed a creative caring workforce, really looking at medical students, so we're looking towards the future. So as you're looking towards your caring future initiatives here through your institute, I would suggest that you look at the student population that is coming through, your medical students, your nurse students, other professions that are allied to medicine, and begin to build in, as we are in Northern Ireland, and developing the whole integral part of creativity that going into our universities and really supporting our students is really one way of making the future a very positive creative environment. So Northern Ireland actually runs, or ArtsCare runs with our local university, Queen's University, a medical module, a self-select medical module, education module for our third year medical students. So we take on about 12 to 14 students twice a year. They come for 3 solid weeks with us. They set aside their clinical training and education, and they try the journey of finding the artist in themselves. And it is an amazing journey where I know I was talking to Sally today, who is the arts coordinator in Flinders Medical Centre, and we were talking about the work that they do in a different model with medical students as well. So part of what they have to do in terms of evaluating their experience is that they have to write a thesis according to Queen's University medical student, but down through the 15 years we've been doing this module, we have actually come to a lovely shared language and translation of knowledge where actually the students are accepted as art students for their 3 weeks course with us, and they are assessed creatively rather than clinically. So for their final assessment, they have to perform in front of their tutors and their peers and any other audience that's involved a choreographic piece of work that they have engaged with and developed with service users or consumers who have brain injury, brain trauma, learning physical disability or dementia. They have to compose with our composers a piece of music that really is an expression of what it is to be a compassionate, empathetic and creative doctor of the future. They will have an art exhibition because they will work alongside our patients and our artists out in wards and units. They will create their own artwork and sense of self-expression, and they will bring that together. It will be framed and it will be hung up as an art exhibition, and they will be assessed in an arts-based evaluation of the impact of the arts on their education. And I think that we have come a long way in that dialogue with Queen's University, and we are very happy that that is a continuing dialogue.
Support.
It's about the individual voice.
Transformative, joyous, and ongoing.
Future is that we wouldn't even be talking about a separate standalone arts in health. It will be just health in general, so there wouldn't be that, you know, because I think all art should be incorporated into the health area.